Okay. Hi, Adrianna.
Hi,
Uh,
Emma.
so good to see you. Thank you for being here. So
Likewise.
you're a marriage and family therapist, Adrianna Rodriguez, who specializes in the treatment of eating disorders, and you're certified as a family-based treatment provider. And you work with high conflict parents and recently divorced couples, significant adolescent or parent pathology, and heightened suicide risk. And you've used modified versions successfully of FBT, which you used with me. So you were my therapist for 2 years full time, and then off and on, right? Off and on.
Right, right.
So you were practicing in Herndon, Virginia at Prosperity Eating Disorders and Wellness Center, and you're still there.
Still
Um,
there.
and English and Spanish, you do treatment in both. That's awesome.
Exactly.
So, um, yeah, so I was diagnosed at UNC Chapel Hill initially in 2013, the summer of 2013, when I was 12 years old, about to turn 13. And then when I moved back to Tanzania, where we were living, that didn't work out with UNC because of different university rules and regulations. So I started treatment with you all online. And I was your first patient who you treated completely virtually. I didn't meet you for like a year, probably, right?
Exactly. I didn't see you in person for about a year. And yes, you were definitely my first virtual
Yeah.
one.
So in a second, I'll get to talking about that because I'm sure, treating someone virtually, especially now, is a definitely interesting topic to talk about.
Mhm.
But first of all, I just wanted to ask you, why do you use FPT? Why do you recommend and why do you use FPT to treat eating disorder sufferers?
So I have been working as a marriage and family therapist for years, and then I transitioned over to working with the eating disorder population. Um, and as a family therapist, I felt really passionate about incorporating the family system into the treatment modality of treating different eating disorders. And I discovered FBT and I went off and I became certified as an FBT therapist. Um, I believe in FBT for many reasons. One is, again, like I said, I feel like it's essential to incorporate families into the eating disorder treatment. FBT has also emerged as a really effective intervention for the treatment of anorexia nervosa. I love that it's goal-oriented and it tends to work faster than traditional therapy. So FBT, focuses on achieving recovery by treating the symptoms directly. So, we look at the concept that behavior change is more powerful than insight. So we centralize the food as the main role in recovery. So the concept of like food is medicine is really what we focus on. And I feel like when we target the behavior piece, which again, FBT doesn't look at like etiology, we don't look at what caused this or past things. We just look at this is where we are and we're going to move forward.
Right.
So I felt that in that regard, it was so effective and it was so laser focused on reframing and changing behaviors that we were seeing a lot of success with that.
Mm-hmm. I think for me, especially for my family, having multiple people who were anorexia sufferers, and none of them, my mom, who, when FBT didn't exist, and she got, terrible advice and terrible treatment. And then my sister too, when FBT was kind of just starting starting to be used by clinicians in the early mid 2000s, but she didn't really get that treatment. So then I came along and it was so lucky that we were able to meet someone like you or a number of other clinicians practicing FBT, but definitely would not have been the same situation had I not met you or been treated that way.
Well, I was so glad you found me and that I was able to help.
I know, and it's so great that we've been able to maintain a relationship. So before I ask a question about, virtual treatment, this kind of, especially since my mom has gotten so involved in eating disorder activism now, how through FBT or you yourself as a clinician offer support to parents during this whole process for an eating disorder sufferer?
So I feel like support for the parents is so crucial and imperative because they're doing such difficult work. in really taking control of all food choices, variety, portioning, etc. In FBT, we see the families as an integral part of the solution, not the problem. And that really deviated from early eating disorder treatment, where the parents were seen or the families were seen as possibly causing it or the problem. So as a therapist, as an FBT therapist, we offer a lot of support and validation for the parents who are doing a great deal of work, trying to eradicate this disorder. So the premise that we use is that we see the parents as agents for change. A big part of FBT is empowering parents, since the treatment is so much more intensive than a lot of the other modalities. It requires that parents set a really hard line against the eating disorder, and that they consistently externalize the disorder, because that is one of the key components of FBT, is that we're consistently separating the patient from the disorder. Parents need to show a great deal of strength and resolve to kind of push through and nurse their child back to health. I like to tell parents, it's probably one of the most difficult things you're going to do, but it's also going to be the most important thing you do as a parent for your child.
Right. So kind of along that same line, I mean, that since you're a marriage therapist as well, a family therapist as well, I mean, I was from a recently divorced, I was the daughter of a recently divorced couple, but of course I know I had genetic influences as well in eating disorders. Perhaps the divorce had some impact on that, I don't know. But I think it was so important and sometimes difficult probably for my parents to maintain a solid front, both like together, especially if they were already in conflict with each other. And I know I didn't know this at the time, but I know you had like private sessions, or 1 or 2 private sessions with my parents, because you needed to tell them, or both of them needed to be on the exact same page when dealing with me.
Right.
Yeah.
And I think that was one of the things that was challenging above and beyond the virtual aspect.
Right.
Was that not only were your parents divorced, but you guys were living in one place, dad was living in another, I was in a third place, and then managing, how they were, like you said, going to be a united front against the eating disorder and be on the same sheet of music, because that's when the eating disorder really can become masterful and much more manipulative. So that was a tricky situation to be in. But yes, and in terms of like, doing sessions with parents individually, I do that often. More so when I'm sensing that the parents are not really on the same sheet of music and we need to get them more united.
Right. So on the virtual treatment front, what was that transition like for you? How was it difficult treating someone virtually then? And how has that evolved for you in your practice now, especially during the pandemic when you're treating so many people online?
Well, I mean, right now it just feels like the normal thing to do. It's what we can do and what we will continue to do to support our clients. I feel like after I treated you and your family in FBT, I felt a lot more confident in treating local families who either were, not in the vicinity where they could drive to the office. But I did see several other families and used FBT successfully, which was great. Like I said, I think one of the interesting and trickier things with your family was the distance, everybody being in different places, the divorce, figuring out logistics like who was going to get your weight consistently. I'm sure you remember that. And the other thing is, like, virtually, sometimes when you're starting off, it's hard to build, rapport and a strong connection, and the trust that's needed in order to really move forward together. But I've continued offering FBT. I'm still doing it. And we'll keep doing it virtually.
I think that we are able to do it so successfully, or, use FBT so successfully virtually, is just a testament to how effective and successful it can be, because it's really, I mean, you were there to support us, and obviously we couldn't have done it without you, but my parents were there, or my mom and my dad in different times were the people on the ground.
Yes. And they were doing it 24/7.
Yeah, exactly.
You know, I tell the parents that I work with, I say, you know, the vast majority of work is going to come from you guys. Right. And I am here to guide and support you as you go along. But your parents were rock stars, because they were so on point, and they were so passionate about not only learning more and more about the disease and about FBT in general, and how they could be a catalyst for your wellness and success. Mm-hmm. And they were just so deliberate and consistent. So that was another big piece of the puzzle for you.
Yeah, definitely. No, I'm very grateful for it. So the theme this year is, for World Eating Disorders Day, is eating disorders can't afford to wait. And my mom's asking this in her sessions with other clinicians and leaders in the eating disorder field. So, but I wanted to ask you, especially from a personal, you know, we have a personal relationship, why can't eating disorders afford to wait? I mean, you've seen it, you know everything probably, but yeah.
Well, we can't afford to wait for a couple of reasons. One is that all the research shows that early intervention is key for recovery. So the sooner someone gets help, the higher success rate in recovery. You know, and another reason is that this is a life and death situation. It has the highest mortality rate in any diagnosis in the DSM. So, you know, it affects not only people's mental health and mental state, but their physiological body. So I think, you know, the more we put information out and we educate and we share the knowledge that we have, the better off people are going to be who are out there struggling silently and really just can't afford to wait anymore. Yeah. So I love the concept of, you know, let's get on this and let's teach everybody about this. There's been so many stigmas, and it's just gone on for too long.
Right, definitely. And I think me compared to my parent, my mother and my sister, and I'm sure so many other people, like I had very early intervention. I mean, I was probably sick for about 5 months, or it was developing for like 5 months before I started getting treatment. And even though it still took a long time, I mean, I couldn't imagine not having that early intervention. I mean, even knowing my mom and my sister who had issues for years afterwards, and I can't imagine that. And I know no parent would really want their child or themselves to experience that.
Agreed.
So last question, maybe before one last question, but I think FBT, so the third phase of FBT, where the clinician and the parents are trying to transition the sufferer into a more normal environment, like they're eating on their own, getting back involved in activities with their friends. I think I had some difficulty with that, just because it's a giant change. I got used to eating like so much food, you know, all this like cupcakes all the time, stuff like that, and it was delicious and great, and not doing any exercise because it wasn't healthy for me at the time. So for a few years, you know, so transitioning to that was difficult for me, and I think that was probably the hardest part of FBT, was being on my own. But it's also a part where you need to learn how to be able to do things by yourself. But I was just wondering, do you think there's room to evolve in that aspect, for FBT to evolve in that aspect, to better equip people or sufferers for their journey beyond recovery?
Yeah, it's a great question. You know, I think transitions in general for most people are difficult and can be tricky. You know, and then when you're going from transitioning to, you know, parents having full control, to then you regaining control, and then shifting over to phase 3, which really is about kind of, again, practicing normal eating patterns and replacing distorted thoughts and perceptions of food and weight and body with healthier ones. Along with phase 3 being about relapse prevention, like how do we prevent you from kind of falling back down that rabbit hole? I feel like as you transition out, it just requires continued support from, parents and loved ones and clinicians. Somebody in the field that you can still kind of do these check-ins with. I have found that to be really effective, that it's not just a hard cutoff,
Right.
but that maybe at that point, the individual starts seeing somebody for individual work to really maybe work more on themselves and create a better sense of self-awareness in relation to food and their eating habits. And the thing is that everybody's journey is so unique, and different, that I think it's hard to kind of do a cookie cutter mold of like, this is what you should do post FBT treatment.
Right.
But just like anything else, the more practice you have at eating normally and engaging in the world normally around food and food messages, the easier it gets and the better it gets for you. So I don't think that after phase 3, it's just like,
Oh yeah.
you're 100% great and you're going to have no issues. Like we know, eating disorder recovery is not a straight shot up. It's really messy. And there's going to be difficult moments and you may have these dips, but that doesn't necessarily mean that you're going back to square one.
Right.
So for me, I'd say that yes, there is definitely room for further development on that and life beyond the 3 phases, but overall, I'd say just continued support throughout.
And I think, there's a point in your eating disorder journey, especially, at least this was my experience, and I've talked to other people about this, where it's like you're 50% yourself and 50% the eating disorder.
Yes.
So after I had a few relapses, I think, or maybe one bad one or something, it was really the point where I had the tools and the equipment and the support that I needed to continue on by myself individually.
Right.
And I had to make a conscious decision, like, am I going to go back down the anorexia path where it will consume me again, or am I going to move away from it? And there's a certain point after, for me, probably like 7 months of treatment, where it was, okay, I need to figure out what I'm going to do moving forward, because my parents, my therapists aren't going to be there to be with me and hold my hand constantly. But of course you were for a long time to do that. So that was really great.
And you did a fabulous job. You're such an amazing example of what recovery looks like. And I respect and admire you so much for your passion for passing along information and educating and creating further awareness. I just think it's amazing.
Thank you. It wouldn't have been possible without you.
Thank
you. Just one last question. Do you have any message or words for World Eating Disorders Day 2020 that you want to pass along?
First of all, I'm honored and happy to be a part of this. As you know, I feel very passionately about treatment and helping others who are struggling. So I'd say the world needs to have an open mind and open ears and open heart, and learn to recognize signs in loved ones, friends, anybody, so that we can all commune and get the word out and help one another.
It's a great message. Thank you so much.
Thank you, Emma.
Thank you for being here.